Bipolar disorder. Bipolar disorder, formerly called manic depressive illness or manic depression, is a mental disorder that causes unusual shifts in mood, energy, activity levels, concentration, and the ability to carry out day to day tasks. There are three types of bipolar disorder. All three types involve clear changes in mood, energy, and activity levels. These moods range from periods of extremely up, elated, irritable, or energized behavior, known as manic episodes, to very down, sad, indifferent, or hopeless periods, known as depressive episodes. Less severe manic periods are also known as hypomanic episodes. Bipolar 1 disorder, defined by manic episodes that last at least 7 days or by manic symptoms that are so severe that the person needs immediate hospital care. Usually, depressive episodes occur as well, typically lasting at least 2 weeks. Episodes of depression with mixed features, having depressive symptoms and manic symptoms at the same time, are also possible. Bipolar 2 disorder, defined by a pattern of depressive episodes and hypomanic episodes, but not the full-blown manic episodes that are typical of bipolar 1 disorder. Cyclothymic disorder, also called cyclothymia, defined by periods of hypomanic symptoms as well as periods of depressive symptoms lasting for at least 2 years, 1 year in children and adolescents. However, the symptoms do not meet the diagnostic requirements for a hypomanic episode and a depressive episode. Bipolar disorder is typically diagnosed during late adolescence, teen years, or early adulthood. Occasionally, bipolar symptoms can appear in children. Bipolar disorder can also first appear during a woman's pregnancy or following childbirth. Although the symptoms may vary over time, bipolar disorder usually requires lifelong treatment. Following a prescribed treatment plan can help people manage their symptoms and improve their quality of life. People with bipolar disorder experience periods of unusually intense emotion, changes in sleep patterns and activity levels, and uncharacteristic behaviors, often without recognizing their likely harmful or undesirable effects. These distinct periods are called mood episodes. Mood episodes are very different from the moods and behaviors that are typical for the person. During an episode, the symptoms may last every day for most of the day. Episodes may also last for longer periods, such as several days or weeks. Sometimes people experience both manic and depressive symptoms in the same episode. This kind of episode is called an episode with mixed features. People experiencing an episode with mixed features may feel sad, empty, or hopeless, while at the same time feeling extremely energized. People with bipolar disorder are more likely to seek help when they are depressed than when they are experiencing mania or hypomania. Taking a careful medical history is essential to ensure that bipolar disorder is not mistaken for major depression. This is especially important when treating an initial episode of depression, as antidepressant medications can trigger a manic episode in people who have an increased chance of having bipolar disorder. Some bipolar disorder symptoms are similar to those of other illnesses, which can make it challenging for a healthcare provider to make a diagnosis. In addition, many people may have bipolar disorder along with another mental disorder or condition, such as an anxiety disorder, substance abuse disorder, or an eating disorder. People with bipolar disorder have an increased chance of having thyroid disease, migraine headaches, heart disease, diabetes, obesity, and other physical illnesses. Psychosis. Sometimes a person with severe episodes of mania or depression may experience psychotic symptoms such as hallucinations or delusions. The psychotic symptoms tend to match the person's extreme mood. For example, people having psychotic symptoms during a manic episode may have the unrealistic belief that they are famous, have a lot of money, or have special powers. People having psychotic symptoms during a depressive episode may falsely believe they are financially ruined and penniless, have committed a crime, or have an unrecognized serious illness. Anxiety. It is common for people with bipolar disorder to also have an anxiety disorder. Attention deficit hyperactivity disorder. It is common for people with bipolar disorder to also have ADHD. Misuse of drugs or alcohol. People with bipolar disorder may misuse alcohol or drugs and engage in other high-risk behaviors at times of impaired judgment during manic episodes. Although the negative effects of alcohol use or drug use may be most evident to family, friends, and healthcare providers, it is important to recognize the presence of an associated mental disorder. Treatment can help many people, including those with the most severe forms of bipolar disorder. An effective treatment plan usually includes a combination of medication and psychotherapy, also called talk therapy. Bipolar disorder is a lifelong illness. Episodes of mania and depression typically come back over time. Between episodes, many people with bipolar disorder are free of mood changes, but some people may have lingering symptoms. Long-term, continuous treatment can help people manage these symptoms. Medications generally used to treat bipolar disorder include mood stabilizers and second-generation atypical antipsychotics. Treatment plans also include medications that target sleep or anxiety. Healthcare providers often prescribe antidepressant medication to treat depressive episodes in bipolar disorder, combining the antidepressant with a mood stabilizer to prevent triggering a manic episode. Psychotherapy, also called talk therapy, can be an effective part of the treatment plan for people with bipolar disorder. Psychotherapy is a term for a variety of treatment techniques that aim to help a person identify and change troubling emotions, thoughts, and behaviors. It can provide support, education, and guidance to people with bipolar disorder and their families. Treatment may include therapies such as cognitive behavioral therapy and psychoeducation, which are used to treat a variety of conditions. Beyond treatment, things you can do. Regular exercise. Regular aerobic exercise such as jogging, brisk walking, swimming, or bicycling helps with depression and anxiety, promotes better sleep, and is healthy for your heart and brain. There is also some evidence that anaerobic exercises such as weightlifting, yoga, and Pilates can be helpful. Check with your healthcare provider before you start a new exercise regimen. Keeping a life chart. Even with proper treatment, mood changes can occur. Treatment is more effective when a patient and healthcare provider work together and talk openly about concerns and choices. Keeping a life chart that records daily mood symptoms, treatments, sleep patterns, and life events can help patients and healthcare providers track and treat bipolar disorder over time. Patients can easily share data collected via smartphone apps, including self-reports, self-ratings, and activity data with their healthcare providers and therapists. Living with bipolar disorder can be challenging, but there are ways to help make it easier for yourself, a friend, or a loved one. Get treatment and stick with it. Recovery takes time and it's not easy, but treatment is the best way to start feeling better. Keep medical and therapy appointments and talk with the provider about treatment options. Take all medicines as directed. Structure activities. Keep a routine for eating and sleeping and make sure to get enough sleep and exercise. Learn to recognize your mood swings and warning signs such as decreased sleep. Ask for help when trying to stick with your treatment. Be patient. Improvement takes time. Social support helps. Avoid misuse of alcohol and drugs.